Welcome to NHA Today, where we explore the path to lasting health and fulfillment through a whole food, plant-based lifestyle. Each week, we bring you real conversations with doctors, health experts, and everyday individuals who've transformed their lives through food, mindset, and community. This is NHA Today, powered by the National Health Association.
Welcome, everybody, to the NHA podcast, and I am so excited to be your host, and I am introducing someone who has been near and dear to me now for many, many years. I have referred many people to her, and I think she's referred a few to me as well. We're kind of a mutual admiration society, but I'm going to introduce to you Kylea Rorabaugh. And I've got a little bio here to read for her, but we're going to hear a lot more from her. She began her counseling career 20 years ago as a licensed professional counselor. She obtained her Bachelor of Arts from Point Loma Nazarene University and her Master of Arts in Counseling from the University of Missouri, Kansas City. Kylea works with clients of all ages, and she specializes in looking outside that traditional therapy box. And she works with the whole person. And that does include nutrition, which we're going to talk about. She lives on a small farm in Kansas City, Missouri, with her husband of 26 years and her youngest son, who is 17. She looks too young for that, doesn't she? If she's not in the office, she can be found working the farm, spending time with her faith community, or enjoying time with her family. So, welcome, Kylea. I was so happy when you agreed to come on and share some time with us and some of your passion and expertise in helping the whole person to become whole. So I'd love to ask you, can you share a little bit about, I know we just read your bio, but can you share a little bit about your background as far as, why did you choose this particular field?
Yes, I would love to. And I'm so excited to be here. So thank you for the introduction. So it dates back many, many years. I actually grew up overseas and went to boarding school as a teenager and kind of became the dorm counselor, not because I was searching for that position, but everybody seemed to come to me for whatever reason. And actually, my mom said, "Have you ever thought of going into the field of counseling?" And I thought, no, absolutely not. That's not for me. And very quickly determined that is exactly the field that I was called to. So it started many, many years ago. And kind of fast forward when I started my bachelor's in psychology as a 18-year-old, I did not have any idea what that was really going to look like, but it was very soon apparent that that was exactly the calling that I feel God had on my life. So I entered into that degree program and then proceeded on to my graduate work, and all of the pieces just kind of fell into place. And I stepped into the profession directly after graduate school as I went through licensure and all of that. Lots of opportunities to share that calling and that passion before I was even licensed. And then every door just seemed to open organically from there. And then I took a big step away when my kids were little, stepped back in, and I feel like the passion for it was just renewed in a very different way as I had learned so much, not just about life, but also about that whole person approach, which I was always drawn to, but didn't have all of the knowledge or life experience to be able to kind of put those pieces together. So that's kind of where I am now, or where that has brought me to now. So kind of a little bit of a background.
Yeah, thank you. So I would love to hear a little bit more about that whole person approach. And I know that could probably be a 3-day conversation.
Yes.
But take your time. We're not in a hurry. I would love to hear that because, outside the box, I know in my field, and we're not here to talk about me, but I've always been very different in my approach to things, not the conventional approach. And that has kind of bitten me a couple times because people don't like it when you're treating or thinking or providing plans of care that are outside the box. So I would love to hear how you ended up transitioning to that, and maybe some, I don't want to say pitfalls, but some obstacles that you may have faced, and how you navigated those.
So again, I'll rewind the clock back to graduate school and I'm sure you can identify with the very same thing or very similar. The way that counseling was taught was very theory based. It was very diagnostic based of let's come up with every kind of diagnosis possible and let's talk about it and figure out how we can give people those labels. It was very centered on pharmaceuticals, where that was integrated into all of the plans of how we help people. And never once over the course of my graduate work did I ever come across anything that was whole body approach at all. Not nutrition, not anything really outside of here's the theory that you choose and you work from that theory all the time. And let's make sure that medication is one of the things that we learn a lot about. Oh, and testing. Testing is the other thing, testing to see if someone has this or has that, or if there's some biological cause, or, and on and on and on. So I really exited graduate school feeling completely incompetent and went into practice immediately as a provisional license, or with a provisional license, and felt completely lost. At basically every person that I saw, I felt completely terrified and also inept, because even my supervisor kind of came from the same model. And I loved him, but he was no help in that realm either. And so what it caused me to do, and I was young and I don't even feel like I had the life experience to really provide to the people I was working with, and I didn't have the knowledge from a training perspective. And so I felt very, very alone. So what that created in me was just a kind of a fire and a passion to learn and research all I could, because I realized if I didn't do that, I was just going to be walking in to every situation with the people I was working with and feeling like I really couldn't help them because the tools that I had attained at that point were not sufficient. So what that turned into is I developed, I think, just this voracious appetite for knowledge and research and trying to figure out how can I help people, because the traditional system is not working. Now, at the same time, I was trying to kind of pull together the things that I had learned to see if there was any substance there. And I actually started off by saying, okay, I don't want to throw everything out because there's got to be some valuable information here. And so I did kind of much more traditional work in terms of I was diagnosing people. I was billing insurance companies, which requires diagnosing every single person in order to get that billing. And so I kind of fell into that path of what else are you going to do? This is how the system works. And so I guess I'm going to have to kind of follow along with it. And medication too. Well, all of the other practitioners are doing it. It's what we learned in school. Even my supervisor recommends them. And even though I couldn't prescribe them, I very consistently said, I think this would probably be a good add-on to what we're doing here, because this is probably not enough. But again, I was really struggling with that, really battling. Wait a second. I don't want everybody to have a label. And I also don't want there to be this undercurrent of medication. Oh, it takes the edge off. But really what that was producing was it took the edge off to the extent that people no longer really wanted to work through the hard stuff. And the adverse reactions and side effects and withdrawal process were absolutely miserable for people. And so again, I kind of went back to the drawing board and said, there's got to be something else to this. And I've got to learn what that is. And so I started to dive into researching the whole dynamic of, okay, so what are we missing here? And what are we not catching? And why is this not working? Because I was seeing people come back to me over and over and over again, and we weren't really making progress. So that kind of created this desire to look outside of what I had been taught, and even outside of what I had researched at that point, which thinking back, I was flying blind so much of the time, and it was miserable. I was completely burned out because there was no support. That's one of the obstacles, I would say. I had absolutely nobody in my corner. So I felt like I was in a practice with one other person, my supervisor, who was no help at all. And I would see him walk into the office every day, with his cup of coffee, his donut, fast food for lunch, all of that. So my growing desire to look at the whole person, including what we're putting into our bodies, he didn't get. and was not, it just kind of that glazed over look, like patting me on the back, like, oh, that's nice. Okay. And so I felt like I had no support. And unfortunately, I really have never found another group or person who really resonates who's in my profession. So that has been a huge obstacle. I don't have very many people in my corner that I can bounce ideas off of in the mental health field, because I'm not only do I not recommend medication, I feel like the whole body approach is not really, it's not really optional. It's not, oh, well, this person's interested in these other things, so I'll talk to them about that. Or, well, this person thinks nutrition is important, so I'll talk to them about that. It's everybody, I think, needs to understand how intricately woven our bodies and our minds are. And so that's not a popular opinion. It's certainly not a popular opinion not to recommend medication. It's not a popular opinion to not use insurance or diagnosis, based therapy. And sometimes, I mean, that's kind of not popular in the whole realm of mental health, but it's not popular with a lot of people trying to come and see me too. Oh, you don't use insurance? Well, then never mind. I'm not paying out of pocket for that. Or it's fine. I don't mind a diagnosis. I already have 5. It's okay. Just use that. So those have been some of the obstacles, but also I think that um, the whole body approach, but also what you read in that bio, I'm so outside the box that sometimes I think it's more complicated from the perspective of, I'm not saying, okay, take this medication. Here's your diagnosis. So let me flip through my diagnostic book and tell you what we're going to do. There's a little bit more trial and error sometimes where, you know what, there is, and this is one of my kind of key sayings or philosophies, there's no cookie cutter approach that I have to offer. It is different every single time that I work with people. And so I have had people say to me before, again, this is kind of one of those obstacles is, but I just feel like you're just treating me like a guinea pig. Or I don't want it to trial and error. I don't want to try this and that and the other thing. And one of the responses that I offer is, the reason that we do it this way is because I'm never going to treat you like everybody else. And we are not looking at a simple person. We are looking at someone who's complicated, and that's a beautiful thing, not a negative thing. But we're kind of messy. We're very complicated, and I think that that's what makes us so unique. So if I were to offer you the textbook option or the inside the box kind of option, I don't think I can help you. So that, generally speaking, is kind of the salve, if you will, of, okay, I think I can be okay with that. And some, I have had people who say, you know what, I'll take the medication and the traditional way of doing things, use my insurance, take a label, and maybe I'll work through stuff, but that medication's kind of taken the edge off, so I don't necessarily need to. So those would be some of the, I think, the main barriers that I have encountered. And even though I don't believe that people traditionally need to be in therapy for forever, that is not the goal. That's never my goal. I think sometimes that outside the box way of looking at things, sometimes it does take longer just because we're fine tuning a very intricately wired person. And that's not a simple process. But one of the other things that I frequently tell people is, there's always something else we can do. So the beauty of looking outside the box is it's an endless array of options of things that we can put together. And sometimes we have all the pieces right, but they need to be ordered differently. Or maybe we just need to remove one thing and add something back in. But the reality is, nothing in this realm is unfixable. But it may take work and it may take intentionality and consistency, but we always have options. And so that also gives us the opportunity to look at, maybe we look at nutrition and we're focused on that. And maybe we hit kind of a block or a stumbling block or a speed bump, and we need to pause there before we progress further. But then we can step into another area and we can look at something like someone's community, or we can look at someone's physical health and well-being, or not just even in the realm of nutrition, Maybe it's movement, or maybe it's mind reframing and work. But there are so many things that I think we just miss. And that's why we have people in therapy for 30 years and they never really get any better. So that's kind of an overview. And yes, we could talk for days and days about this because it's a huge topic, but I think those are some of the key things, obstacles that I've seen, and kind of what that outside the box looks like.
Yeah. Well, I think that was a beautiful overview sprinkled with a lot of detail. So I'm sure that helped everybody listening right now. And hopefully, they're all going to realize, oh my gosh, I have options. I don't just have to go to somebody who has this cookie cutter approach, who gives me a label and gives me the textbook thing. So I was jotting down some notes here, if people noticed, because I wanted to sort of emphasize a few of the points that you made and clarify a few things. Have you clarified? So the first thing that I jotted down was that feeling incompetent after graduation. Now, I felt the same way. When I graduated and got my license as a PT, I felt completely incompetent. You graduate with this entry level knowledge, but you don't really know how to fix anybody or help anybody. And then it's, okay, what do you take after that? Because, and people might be surprised to hear this, but we don't even really learn a lot about exercise. I mean, it's crazy now. I did graduate over 30 years ago. I know things have changed slightly. It's now a doctorate, but that just means they're better at research. It doesn't mean they're better at fixing people.
Yes. Yes.
So we've got all of that, right? So that incompetency after graduation, that's crazy. And I think everybody feels that way. So yeah. And then, yeah. And then when you shared, I wrote down cookie cutter approach due to the label, and then you actually mentioned the cookie cutter approach. So what I found in my field is each person is unique, like a fingerprint, as you said. We are so unique. I kind of joke and say everybody's like a snowflake,
Yes.
Everybody's
Oh, I love that.
And there's this thing about evidence-based medicine. Now, I would love to hear your thoughts on that, because in my field, I'm dealing with people with chronic pain, and I'll have 3 people come into the clinic with the same diagnosis, the same symptoms, but require completely different plans of care to resolve because they're so unique. They have a different history, different medical history, injuries, accidents, traumas, their personality, their way of life, their job, there's so much unique about each one of us that I found evidence-based medicine. My professional and personal opinion is it will never work for chronic pain. So I would love to hear your thoughts about that in your field.
Yes. I love that explanation from your perspective too, because I feel very, very similar about that. And kind of the way that I talk to people about that very thing is research is great. And I'm a huge fan of research, but sometimes research misses the person. And that's kind of one of my very common statements when someone says, oh, but does that work? Or, oh goodness, I've never heard about that before. And I'll reference it in that way of I think research has a place, and being able to prove to you that this method works, or that this treatment protocol that I'm suggesting is backed by, 52 studies. But I can't do that because that research is not talking about you.
Yes.
And that is so much more important to me. And so I use that to an extent, but it is not central to how I do what I do. And that, a lot of times people will say, okay, so what therapy do you utilize most? And it's such a big question, because even though, I do a lot of cognitive behavioral therapy, yes, but I never do just that. I might have elements of that, but that doesn't fit every personality, nor does it fit every person. And so I kind of tend to stay away from, these are my credentials. Here's how I do things. Here are the types of therapies I use, because it just would not describe the way that I work with people, because I am drawing from so many different things. And quite frequently, I am searching for the creative alternative to many of the traditional, pieces of therapy, because I just don't believe that the traditional or evidence-based therapy in this instance is really applicable so much of the time, and it misses the essence and the beauty and the intricacies of that one person sitting across the room from me. So I completely wholeheartedly agree with you, and your approach to that is we can't solve people's battles or struggles or challenges. And in fact, one of the things too is that I frequently say is, you're not broken. We're not working with a broken person. There are
Yes.
just some things that we need to work through. We need to strengthen this over here. We need to master this skill over here, but you're not broken. Because if our focus is upon fixing that which is broken, then we're just going to have a broken mindset, and we're going to get absolutely nowhere, because we're just going to be searching for and racing after the fix to the brokenness, rather than you have so many strengths. And that's one of the things that I do with people frequently. Let's talk about your strengths, because your strengths oftentimes are going to overwhelm the things that you struggle with a little bit. Let's use those to the best of our advantage. And I think also being able to have, what is it that we're looking for? So instead of, like in your profession, instead of focusing on the chronic pain, you're looking beyond that. Because if you were always looking at pain and pain and pain, that becomes the mindset of a person. And so the same thing applies too, of if I'm so centered upon the diagnosis and the theory and the type of therapy that I'm offering, that's kind of a disease model in a different way. And we are just trying to pinpoint and label you with the disease that you have. And essentially, it's, how broken are you? And let's focus on that. And that does not do anybody any good, because it's really discouraging. And that's what I think cements people in that mentality of, I'm never going to get beyond this, because their mindset is so centered around that brokenness or the things that are wrong. In addition to, and maybe this kind of goes back to one of those obstacles too. I have many people who have come to me after years and years of therapy, and they have been told over and over and over again that they're not fixable, that this is a problem. If you have this diagnosis, you will always have this diagnosis. And you can just bet that you'll always be on medication and you'll always be in therapy for the rest of your life. And so they come with a trauma past from other therapists, which becomes it's a struggle sometimes to kind of rewire some of that thinking too, because it's been so damaging in the past. And that's not the way that I ever want to be seen, or for my methods or the ways that I engage with people to look. So hopefully that answers the
Yeah,
question.
it's absolutely fascinating to me. I would say jaw-dropping, the parallels in, I think, every facet of healthcare. Because I
Yes.
see the same thing in my profession, where people are given a diagnosis based on imaging or
Yes.
based on their age. Well, what do you expect at
I,
your age? You're supposed to have joint pain, or you're supposed, and it's absolute lies from the pit of hell. I mean, it's absolute
yes. Oh,
nonsense.
absolutely agree.
And
Mhm.
I love the fact that your goal is not to treat people, it's to resolve their issues. And you're right, they're not broken. When people come to me, I'm like, you're not broken. There's nothing wrong with you. What's happened is you've been given information that is inaccurate or missing detail that you haven't
Yes.
learned yet.
Right.
And you've just been navigating the world the best you could based on what you know. Well, I'm going to teach you some things that you didn't know
Right.
that are not necessarily mainstream knowledge, but should be.
Yes. Yes.
And so that's why we're doing this podcast, because people need to hear what you know, Kylea. And there's a lot of people listening right now who probably struggle with a label that they were given. And I
Right.
agree. Once you're given a label, you do feel like you are at a disadvantage to the rest of the world,
Right. Right.
because you're not like
Exactly.
everybody else. You've got this, or you've
Exactly.
got that. And so now I would love to move into the whole nutrition aspect of this,
Yes.
because
Yes.
in my field, people are really surprised to hear when I tell them that, guess what you put in your mouth can promote degenerative disc disease, can
Yes.
impact your posture as you age, can impair circulation to those joints and cause that joint damage that the University School of Medicine, Stanford, learned it's chronic inflammation. It's not wear and tear, old age, gravity. So
Yes.
you've learned that nutrition really impacts our mental and our emotional health.
Mhm.
And so I would love to hear more about that.
Yes. So this is actually something that I stepped into early on in my practice. I was fascinated by the whole realm of nutrition and how that impacts our mental health. And back then, of course, we didn't have, you couldn't get on your computer and like search and find all the articles. Like I was trying to go to the library and find books that had, some kind of content that I could use, and going and looking at journal articles and trying to piece together this paper. Actually, I put together a paper. I'm like, okay, I have to have some research to support what I know to be true. And it was a very lengthy, very difficult process because, like I said, back then I didn't have all of the tools that we have now, and there just wasn't that much out there, or at least it was very difficult to find. But I knew without question, even at that point early on, that that had to be a component that we talked about. And so I would toss it into the context of conversation with people. But again, kind of going back to what we talked about before, I felt so completely inadequate in my ability to explain how important it was and how it worked with mental and emotional health. And so I think I would probably say I kind of dabbled in it, because even though I felt very strongly about it, I didn't feel like I had enough experience. I was young. I felt like people would be, looking at me saying, okay, so where's the evidence? Because I don't know, you don't have a lot of experience in this. And so I kind of shied away from it. So fast forward to when I entered back into practice after staying home with my kids, it was kind of one of those things that I had experienced. I had completely changed my diet and lifestyle and had become completely plant based at that time. And I knew how it impacted me and my family. But also, I could just see in individuals, people that I knew or family members, I could see the impact of it. And so it had become something that I had just gone totally all in to learning about. And in that realm, there is a tremendous amount of research that supports the fact that what we do put in our bodies, like you said, with joints and muscles and bones and all of that, it also impacts our mental and emotional health dramatically. And so it became something that wasn't the occasional, well, I mean, if you want to kind of look at how you're eating, or, well, maybe, add a couple more fruits and vegetables, it became something was much more central that I know without question, yes, from research, but stepping away from research, I know because I have so many people, whether it's eating the standard American diet, or people who don't ever touch a vegetable or a fruit, or people who are drinking soda and beer all day long, or, filling up on pastries and donuts and ice cream and, all of those things. And those people are the people who say, oh no, that doesn't impact anything. And I'm not interested in changing it. And yet they're miserable physically, but also their mental wellness is impacted dramatically, to the extent that, we might make a little bit of progress and then we just hit that wall where, if you're not fueling your mind and your body with effective fuel, you're not going to have a brain that's well established to the extent that you're going to be able to reform some pathways. We don't have that fertile ground. And so we're going to struggle there. Now, maybe, okay, let's put that aside and let's just, we'll focus on some other things. And yet the brain fog, I know that's an overused word, but just kind of that mental muddiness is sometimes how I refer to it, where there's not clarity, there's a lack of focus. They don't feel physically well, so they can't get out of bed in the morning, stick with their routine, etc. And so it just becomes this domino effect where the things that I'm asking people to do, they just simply can't do because they're not fueling their bodies and they feel horrible. And so feeling physically horrible is going to impact the mental ability to do what it takes to restore or to resolve the things that they're dealing with. And so there's that piece of what are you putting in your body, and how is that impacting your brain's ability to rewire, to form a new circuit, to um, practice that reframe or that new narrative in the brain. Like, it is so impactful, the things that people put into their bodies. Now, you mentioned, inflammation. Well, things like, I'll pick on dairy for a second because that's one that I focus on a lot. If you're filling your body with dairy, for example, there's so much inflammation in the body that not only do you feel terrible, but it can also oftentimes exacerbate some of those more functional disorders like IBS, for example, where you have an explosion of symptoms because of the things that you're doing to exacerbate the issue. Well, IBS is very much an emotional and mentally based thing that people struggle with. And so if we're trying to do something over here, but really this is the central problem, we're not going to make any progress. And what that does then too is it discourages a person to say, see, I go back to, I'm broken. Nobody can fix me. I guess I'll just go down, the traditional route, or I'll take the medicine, which in fact doesn't alleviate the symptoms either, because we're not addressing that central piece. And so there are some specific things that, for example, I'm working with someone with a very functional basis, meaning it's not an all in your head issue, but it is very much impacted by the emotional and mental well-being of the person. And so they have very physical symptoms, but the mental and emotional key is very central to it. And kind of initially it's, oh, but I eat well, and I'm pretty good at drinking some water. But then when we get down to it, they're drinking a fraction of what their body needs to detox all of the junk they're putting into their bodies. And that, oh yeah, I do pretty well, is not the definition of fueling your body.
Oh, I've had
And
many people
so,
tell me they eat well, and then when you find out
yes,
what they're eating, it's how can they think that's eating well? But that's the mainstream mantra, right?
right. Exactly. Exactly. So they've been taught those ideas and they don't think that it can possibly impact them. But the other thing about that is, changing in that arena is something, it may be challenging for somebody who isn't used to eating that way, but it's doable for everybody. And one of the other things people will say to me is, "Oh, but I could never do this." Or I like this too much. One of the other things too that I really focus on is we're not looking for perfection, but also we're looking for incremental but successful and consistent change. And so let's work with this piece right here. Or something also that I kind of use as a central concept is let's add something rather than focusing on eliminating something.
Yes.
And oftentimes, when somebody steps into that place of, okay, I can change that, there's success, there's a feeling of encouragement, victory, I did it. But then there's also the byproduct of they start to feel physically better. And if all of us could agree with this, when we feel physically unwell, we don't feel mentally well either. We don't feel emotionally well. And we certainly don't feel capable of taking on a challenge. And so I think there are so many different facets of whether it's fueling the body, detoxing the body just by the foods we eat. I'm not talking about a colon cleanse, but detoxing the body by flushing it out, with good hydration and with high fiber and with all of the beautiful nutrients that are in fruits and vegetables and whole grains, all of that. We're doing that layer. We feel physically better. We attain this sense of, I can do this. And there are so many stair steps that I can keep improving. I can train toward better wellness. And then there's the element of, what am I giving my brain to work with? If I'm asking for some rewiring, that whole concept of neuroplasticity where the brain can change those circuits, well, the brain has to be healthy in order to do that. And so we have that component. And so it's not just one thing, it's so many different things that contribute to why nutrition in and of itself is such a key component to mental and emotional wellness.
Yeah.
So,
Yes. I love
huge
that.
topic.
I love that. Yeah. There's a couple of details that I wanted to comment on. So, We already mentioned a lot of people think they were eating well, and they're really not. They're basing it on
Yes.
the mainstream understanding of what that is. And then, I get a food diary from everybody I do private consulting with, because I'm not going to chase my tail. If they're, living on foods that promote inflammation in the body, we're never going to get their pain levels down. So, and then there's also the piece of the water intake, because muscles are 78% water, and a lot of people, as they age, they're like, I can't grow muscle. Well, you're dehydrated, you're not drinking water, because you're like, oh, I keep having to go to the bathroom. Well, that's how it works, water in, water out. And if you've got some incontinence issues, we can deal with that. There's plenty of exercises you can do fully clothed and upright to fix that problem.
Right.
But and sometimes drinking more water will help the problem. There's data that shows that. And I'm a data girl too. I'm like you. I like the research, but
Right.
people aren't data.
Yes, exactly.
Right. And then there's and I don't know about you, but if I'm thirsty and I know I'm not going to get water for a while, I get irritable. I get like,
Yes.
oh my gosh, I feel so miserable right now. I really need
All you can
water.
think about.
Yeah. Yeah. So, and then I wanted to ask you about the meds piece, because, and we're not talking mental health meds, we're talking, diagnosis of medical conditions, medications. Have you seen those impact? Because I know I see those impact. If somebody's on a statin, their leg pain and their joint pain, and people don't realize. In my one book, I've got a whole chapter on meds that cause pain.
Yes.
People
Yes.
don't realize this. So, what have you seen there?
Yes. Well, you mentioned statins, and that's a great one. I'll start there because in the mental health field, statins, and I'm sure you're well aware of this too, but statins oftentimes create memory loss, memory issues where people begin to struggle with, gosh, I think something's wrong with me because of, something like that. So they may present with that. But also, one of the other things well, let me backtrack just a second. So statins, there are also other medications that can create memory lapses or difficulty remembering things. And so that may be something that is then joined with heightened levels of stress, which can also create memory lapses or difficulty focusing or remembering. So you combine those two things, and somebody might show up in my office and say, gosh, I'm really struggling with my memory, and I think that there's something like I need some exercises or I need something. Well, if we really get down to it, medication is a huge element of it. Now, stress, okay, that can be something else. Well, those are both things that we can work on. But to work with getting off of a statin, for example, which is not my specialty, but if I'm asking somebody to explore that, well, diet and lifestyle are going to be part of that conversation. Um, but also outside the realm of psychiatric medication is one all in itself, but just medical, like you said, medical, pharmaceuticals oftentimes are going to have those side effects of anxiety or depression or distracted focus or ADHD like symptoms, those types of things, which a lot of practitioners, somebody coming in, oh, you have ADHD. All right, here you go. Here's your medication. Here are a couple of exercises and you're on your way. But what if it's that medication that they're on that's producing lack of focus? It has nothing to do with the diagnostic code, but it's very much seated in what they're putting into their bodies from a pharmaceutical perspective. And sometimes it's not even a pharmaceutical, it's an over the counter medication that impacts them as well. And that can impact the way they feel physically, but it can also impact dramatically the way that they feel mentally. And sometimes, whether it's an over the counter or it's a prescription, something too that, and this is a little bit of I'm trying to think of the word, and maybe more expansive way of looking at this, but somebody may be taking something for some medical issue they have. It's not really working, but they don't know what else to do. And they become very discouraged. They may even become extremely depressed as a result of that because their issue, they're taking something for it. That thing is not making them feel better. It's probably making them feel worse, but they're feeling really discouraged that they're doing the treatment for that thing in the first place. And they land in my office because they are devastated and they're discouraged and they just are in the midst of despair because, again, they feel broken. The treatment they've been given isn't working. It's exacerbating their mental health and well-being. And we have this whole conglomeration that could easily be at least ameliorated and the process of healing started if we just stopped doing the thing that wasn't even helping in the first place. So that, I mean, that's kind of, it's more indirect, but can absolutely impact somebody's mindset and their mental well-being and their ability to look beyond that and see, wait a second, there's so many things that we can do here. And here's one relatively easy way that we can begin that process.
Yes, yes, and I'd love to look at the brain and the brain's need for protein that you may be able to comment on, and the brain's need for fat that you may be able to comment on, because I have a lot of people who tell me about that, and all the research I've looked at says it craves carbohydrates, obviously complex carbohydrates. But I would love for you as a mental health professional to share that. But before we get to that, I'd like to just follow up on the thing about stress and memory. My understanding is when you are very stressed, you're in the run from the bear mode, the sympathetic nervous system mode. And that mode will impact the hippocampus, which is where the short-term memory is stored. So that's accurate?
Yes, that's accurate. Absolutely.
Okay. So when somebody can't remember where their keys are, they can't remember this, or they can't remember that, it's not aging, it's they're stressed.
Exactly.
Yes.
Exactly. And that's something that people will frequently say. I cannot tell you how many people have come, and not necessarily because of that, but it's a byproduct of whatever else they're dealing with, of I'm really starting to get worried. I'm only, and they'll throw out a number, and it doesn't matter what number that is. I'm only this number of years and I can't remember this and this and this, or I'm starting to not be able to remember names of acquaintances, or where I walk into a room and I don't remember why. And one of the things that, I mean, I would say is central is that whole concept of the sympathetic system versus the parasympathetic system in our nervous system. So many people are living in that sympathetic nervous system, the fight, flight, freeze, fawn. There's so many of those position
Yeah,
where they're
they're
in
running from
that.
the bear mode. They're running from the bear
Yes,
all day long.
exactly. And there's no bear. But they think there's a bear. And so they live in that state. And the number of symptoms that people have as a result of remaining in that place constantly without reprieve, it's the list is gigantic. And I'm sure you see that in the pain world too. But that impacts so much.
Yeah, their
And
ability
so,
to digest, because you can't
yes,
digest if you're not in the heal and
exactly.
repair mode, which is the
Yep,
opposite. And I tell people it's
exactly.
like the gas pedal and the brake are getting hit at the same time, and it doesn't
Exactly.
work.
It does not work. And it impacts sleep. And it impacts absolutely everything. Which, touching on too, if someone is in chronic pain too, oftentimes, and there can be nervous system elements of that as well, which obviously you're the expert at. But one of the things that brings people to my office too is chronic pain. It is a devastating position to be in. And we have to work not just on the mental piece of that, but we also have to work on, which is not my specialty, that's where you come in, of why is there pain in the first place. And so that becomes a multifaceted approach to things. But so much of the time people aren't looking from that perspective, they're looking at the one issue.
Yeah.
So
Yes.
yeah,
Yeah.
that's a
Yeah. People
huge
are seen as a body part, or a whatever, walk
yes.
through the door,
Yes.
kind of like in the mental health world, they're seen as just a mind that walks in the door.
Right.
There's a body
Right.
attached, people.
Yes. Yes. You can't cut one off from the other. It doesn't work that way.
Yes, yes, absolutely. So I'd love to, in our remaining time, I would love
Yes.
to have you touch on a couple of other things that I jotted down here based on you've been so wonderful. I mean, I think this is going to help so many people. The brain and protein, because, when you're in the plant-based world, you hear about protein all the time.
Yes.
And even some of the plant-based docs are telling people, you got to make sure you get enough protein based on, and they might be pushing plant protein, but
Right.
it's
But
still all
protein.
about the protein. And it's interesting because when I did a really deep dive into the data for aging and protein,
Yes.
it's not accurate. It's not accurate at all. And, okay, I should have no muscle because I'm not living on beef and,
Right.
and
Right.
so, and even the Cattlemen's Association was part of a research study that said that you don't need to increase your protein in order to increase your muscle mass. So even they'll admit it.
Interesting.
Okay.
That's amazing. Yeah.
So it's yeah. So, but I'd love to hear, because the brain and protein, the brain and
Yes.
fats.
Fat. Yeah.
So I would love
Yeah.
to hear your perspective on that.
Yes. So I think the research is very clear. And one thing that I'll tell people, because I'll sometimes get something tossed back in my court of, well, but I read this study over here. I always like to say in response to that, yes, I'm sure you did. I don't dispute that. But you can find a research article to support literally anything that you want to believe. So let's look at things a little bit on a deeper level. And it always comes back to, if we're talking research, it always comes back to, and this is a term that I think we use in the field of the preponderance of evidence, the bulk of research that backs up the claim. And I think if we take it from that perspective, we could take that article that says, yes, your brain and your mental wellness, you have to have protein and fat in very, very large quantities. And they're either, the research is highly questionable for a multitude of reasons. But if we look on the other side of that, of what the mind or what the brain craves, what the brain needs, it is complex carbohydrates, much more so than protein and much more so than fat. But outside of that, high levels of especially animal protein and high levels of fat are going to create inflammation in the body overall. So you're not going to feel physically well. But here's the other piece. And again, yes, like you said, the plant world or the plant-based world, some doctors are promoting lots and lots of protein, but your body just doesn't need that. And so putting something over and over and over again into your body that you don't need pushes out the things you do need. So in essence, we have that indirect relationship too. Then you're not getting the things that are actually going to fuel your mental well-being and your body as a whole. So we have that factor too. But something else, and I'll step just outside the brain for a minute, because here's the other thing, especially for loading up on animal foods. But even if we're loading up on lots of fat and lots of protein, maybe both plant and animal, we also are impacting what's going on in our gut. And that's another huge element of mental well-being, because our guts are largely responsible for neurotransmitters, the things that enable that mental wellness. Something like serotonin, it is mainly produced in your gut. So the reason that that's important is your microbiome is going to feed off of nutrient dense foods, carbohydrates, complex carbohydrates being one of them. But the negative bacteria, they're going to thrive on animal foods. They're going to thrive on lots of fat. They're going to thrive on junk foods of various sorts and sizes. So if we are looking at mental health, it's even looking beyond just the overall health of the body. If we are really specifically focused upon our brains producing and metabolizing and using our neurotransmitters in the way that they're intended to use those things and metabolize them, well, then we need a healthy gut. And in order to have a healthy gut, we have to have a really good microbiome. And a microbiome is going to thrive on complex carbohydrates and nutrient dense foods. And that's not animal foods. That's certainly not high fats. And so that it expands that conversation even more. But here's the other thing. Sometimes I have people say, I'm not supposed to have, and they'll list, the list of things, carbohydrates being a big one.
Oh,
And they'll say,
carbs
I
are
just,
evil nowadays.
oh,
Yeah.
they are evil,
Yeah.
and protein
Yeah.
is in everything. And so, one of the things sometimes I'll say, I think that probably having that, whatever it is, that whole grain something, or, a complex carbohydrate, whatever that might be. I mean, those are talked about as comfort foods for a reason, because our bodies and our minds crave them.
Yeah.
And so when I sometimes give, permission to somebody, I want you to try eating that. Be okay. Like, let's try to remove some of those labels of that's a bad food, you're not supposed to have it. And it's remarkable, just kind of the, okay, this sigh of relief and the, oh, that sounds so good. And I don't have to put myself in this rigid, rule-based way of eating, etc. Um, it's kind of funny how something so simple could be one of those things that we add to the list of things that we're going to change or we're going to use to our advantage. That's not a traditional way of looking at things,
Yes.
but is absolutely impactful. So I know I kind of veered away from your
No,
original
no, I
question.
love it because right now I'm thinking of how many people have looked at me with such awe and thankfulness when I told them it was okay to eat potatoes.
Yes, yes.
They're
That's
like,
one of the key
I can
ones.
have potatoes. I mean, they're like a kid at Christmas.
Right. Yes. Because they've been deemed a bad, unhealthy
Yes.
food. It's crazy.
Yes. Now, of
Yes.
course, if we're covering it in sour cream and butter and bacon bits, and
Right.
there's
Or
a
fried
different
in
culture.
oil. I
Yeah,
mean, there's
yeah,
that.
yeah,
Yeah.
yeah, yeah.
That's not what we're talking about.
Right, right. But oh my goodness, yeah, yeah. The relief they have. So I think in closing, you have been so wonderful. And I know you've helped so many people. And I know that people are probably going to want to reach out to you. And we will have contact information in the show notes for people who might want more information. But would you be able to share just two things? What do they want to look for in a mental health professional should they feel that they need one? And then what have you found are like the most used, most effective strategies that you use, even though you might use a little more of this with some person and less of this because it's based on their uniqueness, just so people can hear those different strategies and look for those too.
Yes. Okay. So, in terms of how to find a good therapist, this is it's one of those things where I typically will list out a few different things, but I think a large part of it has to do with, these are some kind of framework type questions to ask. But they're not all inclusive because I think you have to actually have that conversation with the person before you can really kind of tease out some of the details. And so some of the basic things would be questions that typically probably therapists are not used to having asked, because it's more like, okay, how much do you charge? Do you take insurance? How long are you going to have me here? Those types of things. But one of the questions that's central to me is, do you regularly recommend pharmaceutical implementation, or do you typically suggest pharmaceuticals for helping with mental health? And that's not that I don't say, do you ever suggest, because I think that just kind of puts it in a black and white place, and that's a whole other discussion. But that's one of the questions, because if they say, oh, absolutely regularly, I would say, okay, thank you so much, and hang up the phone. As far as therapeutic style, that's something that I would ask the question, what is that, what typically do you use as your therapeutic style? Now, again, that kind of goes to, like you said, I pull from so many different areas. But if somebody says, I only use, and they fill in a blank, I would be very, very hesitant to probably choose that person, because again, I don't think we can look at it with that kind of a cookie cutter way of looking at things. So you might hear somebody say, well, I generally will use this model. Cognitive behavioral therapy is wonderful. I love it, but it is not all inclusive all the time. So that is one that I would typically say I would probably look for somebody who at least implements that to an extent, because it's very present focused. It's very tools based. So there can be a lot of goodness there. But I would look for somebody who says, I feel that everybody is unique. And so I do use a number of different things, kind of like what I was presenting. I think that's so important. One of the other things would be how long. And I would not be looking for a number, because, again, that puts you in a box and it's just not applicable. What I typically answer to that question is, here's what I know. I don't want to see you for the rest of your life. I'm sure we're going to get along really well, but I don't want to see you for the rest of your life. And I'm confident you don't want me to be part of yours for the rest of your life. And so my goal is to equip you and encourage you and work with you and help build those strengths in you so that you can take what we work on and you can go forward and encounter lots of different challenges in your life without me present. And so that's the kind of question that, you don't want somebody who says 6 sessions, you'll be good, because that's just not true. They just cannot predict that. I also would look for somebody who doesn't say, oh, yeah, you're probably looking at, 10 years, or you're probably going to be in therapy for the rest of your life. You are going to, like, some people will answer that. One of the other things that I would ask is, do you take an active role in the therapeutic process? That might sound like kind of a crazy question, but there are therapists. My supervisor back when I was fresh out of graduate school was one of these people. He'd sit, very kind man. He would sit and he would listen. And he wouldn't really offer a lot of insight, and he wouldn't offer a lot of tools, and he wouldn't offer a lot of direction. Drove me crazy because I want my person to walk out with something they can use. And so looking for someone who's going to offer homework in between sessions, and I will say to someone, I am an active directive therapist. I am going to be equipping you, because we can get a lot done in an hour session, but oh my goodness, we can get so much more done if you are working consistently between those sessions. So I want to equip you to use those things and to practice those things so that you come back and we can talk about those and add to the toolbox. Those are some of the kind of central things that I ask, or would suggest people ask. Like I said, there's so much more to it, but those are some really good framework questions that if you get a lot of those that seem like they resonate, okay, this might be worth a conversation or a session. In terms of things that I use a lot of, yeah, that's a really huge question, but I do use a lot of cognitive behavioral therapy because, again, it's very present focused, not super focused on the past, and not trying to predict the future and what that's all going to look like. It's very much, what can we do to equip you, but also how are we going to shift that mindset so that you are ready and able to work on the things that we're presenting. Something else that I do a lot of work with is nervous system work. You touched on that, but working with the nervous system is so central to mental health and well-being. And that can mean lots of different things, but much of the time that's a very actionable, practical way of allowing the mind and the body to work together to create and to foster the ability to work on some of those deeper issues. So that's also something that I regularly integrate with a lot of the people I work with, is just nervous system central work. The other element is looking at, I kind of use frequently something that I'll call the emotional prescription. And that's where I take lots of different bits and pieces and create this plan of, this is what we're going to start doing consistently to train your way out of the place that you're in that you don't want to be in anymore. And that's, that can include a whole plethora of things, but it is a technique that I frequently use where I can integrate a lot of different kinds of techniques and, therapeutic strategies and things like that. But it's very actionable, very, here's your prescription and this is what you're going to work on, but it allows for that creative integration. So without kind of coming up with a really extensive answer, those would be some key things. It's a snippet, but gives you an idea.
No, I think that was very, very helpful. Yes. All encompassing, but actionable. We got to give people something to do.
Yes.
And, yes. Same in my world, if they're just going to do something when they see me, but nothing in between, we're not getting anywhere.
Right.
So I love it. I love it. So, well, thank you so much for coming on and for sharing your passion and your expertise and so many helpful facts and truths. And if we could close with you giving one piece of advice, what piece of advice would you give people if they feel like they're struggling?
I think what I would encourage people with is, there's nothing that isn't something that we can work with. And even though you're struggling with something, not only is there something we can do about it, there's lots of somethings we can do about it, but also the recognition of that is the very basis of where we need to start. You don't have to feel ready. You don't have to feel real encouraged about the process, but there is always something that we can do with the position that you're in, and you don't have to struggle with it for the rest of your life, because there are solutions, creative as they may be. And the traditional, way that perhaps you have experienced this particular arena or this challenge before does not have to be what you experience moving forward. And so whether it's picking up the phone or writing an email, that's the thing that I think people need to hear is it's not unfixable. It's not that you're broken. We just have to rework some things, and there's always hope. So that's probably what I would say.
Yeah, I love it. I love it. And that's not what people tend to hear in that arena. So thank you. Thank you for that hope. Thank you for being here. And I just hope everybody has a great day who heard this, and will seek you out should they feel the need. Thank you, Kylea.
Thank you for joining us on the NHA Today podcast. Subscribe and follow the National Health Association on YouTube and social media for the latest in plant-based science and healthy lifestyle support. For more resources, articles, and information about our membership and conference, visit healthscience.org. Until next time, here's to your plant-powered health.